Hi everyone, my name is Matthew Lacey. I am a certified lymphedema therapist and occupational therapist with Arkansas Lymphedema of Conway. Today I'm going to discuss manual lymphatic drainage, or MLD for short, for the upper extremity. Before you perform any manual lymphatic drainage, I recommend that you talk to your doctor or your lymphedema therapist to make sure that it is a safe and appropriate treatment for your specific situation. To start with manual lymphatic drainage, there are two different types of strokes or massage techniques that we're going to use today when we're working with the arm. There's a stationary circle, and then there's a general skin stretch that is more a directional stretching of the skin. With the stationary circle, I'm going to demonstrate on my hand really quickly. When you are doing a stationary circle, you don't want to glide over the surface of the skin. You want to take the hand that you're using to do the massage, paste the fingers against the tissue, and actually move the skin in a circle. We're going to use this technique around the joints, so around our armpit, neck, and elbow crease. The skin stretch is going to be more of a directional stretching of the skin. We're going to use this on the long segments of the arm, and I'll demonstrate that as we go. To start with manual lymph drainage, we're going to start on the neck. We're going to do 10 stationary circles at the collarbone. So find the collarbone, come up into the depression, which is a soft area above the collarbone. We're going to do our 10 stationary circles at this point. There's 4, 5, 6, 7, 8, 9, 10. I'm going to then go to the trapezius muscle, which is the large muscle on the back side of the shoulder. We're going to pull that forward. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then come back to the neck for 10 more. 2, 3, 4, 5, 6, 7, 8, 9, 10. I like to incorporate some abdominal breathing when I do manual lymphatic drainage, or diaphragmatic breathing. It's just a big, deep belly breath. To do this, I would sit in a reclined position with a slight bend in your knees. Lean back, rest your hands over your belly button, and take a big, deep breath in through your nose. You'll feel your stomach rise when you breathe in like that. It's the diaphragm drawing down, inflating the lungs. You get a good, deep breath. And you want that sort of a deep belly breath when you're going to try and stimulate lymphatic flow. When you do breathe in and you get the rise in the belly, on the exhale you're going to press in like you're squeezing the air out. So it's going to look like this. We're going to do 5 big deep breaths. You can do more if you want to. In through the nose, out through the mouth. There's 2. There's 3. 4. And 5. After you do the diaphragmatic breathing, we're going to come back to the arm. You can do the remainder of the arm in a reclined position. I'm going to do it for ease of viewing upward like this. We're going to go in the armpit. So you're going to raise your arm or get it into a comfortable position out in front of you any way you can. I'm going to raise it up so you can see. We're going to rest our palm against the armpit, thumb on the inside, fingers wrapping around to the outside of the arm. You're going to do a stationary circle kind of up towards your ear. Really use enough pressure that you can feel the tissues moving around. This is how you're going to stimulate the lymph nodes that are in this area. We're going to do 10 stationary circles or more, which I think I'm doing more right now because I forgot to count. So if you're counting, let's get to 10. Call that a stopping point for right now. More is always okay. You want to do enough that you really stimulate the lymph nodes in that area. If you stop too soon, you may not be getting the full effect from the exercise. After you've done the armpit, bring your hand down and rest it on the elbow, kind of on the outside of the arm where the triceps are. We're going to use this hand and we're going to do our directional stretching of the skin, working up elbow to shoulder. When you do this, stretch the skin, let it fully relax. Then move to the next segment, which is about a hand's width above. Stretch, relax, stretch, relax. It's best to do this in a position where you can prop your arm on a pillow, get it slightly elevated. It helps to relax the muscles in the arm and you're going to get a better skin stretch. When you're doing any of the long segments of the limb that's affected, you're going to work from joint to joint in an upward motion. Always stretching up because that's the way you want fluid to travel. It's the best, easiest way to think of that. We're going to do this about 5 times. So this to shoulder is 1 time. Come back. There's 2. 3. 4. And 5. You're going to do the outside of the arm first. We're going to come into the inside. You can either stretch up from the elbow in this position. I like to get the arm up. You get a little bit of stretch through here, but you also make it easier to get a stretch with the other hand on the inside of the arm. So come to the elbow. We're going to come on the inside like where the biceps are. Stretch, stretch, stretch. Here's 2, 3, 4, and 5. So we've done the outer and the inner part of the arm. We're going to go to the elbow crease. At this point, it's another stationary circle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, the stationary circle is sort of a semicircle, so there's a stretch and relax phase. So you're going to stretch, let it relax off. You always want to do your stretches toward the direction you want flow to happen. The next thing we're going to do is the forearm. We're going to do the outside of the forearm. It's the exact same as what we did on the upper arm. Here's 2, 3, 4, and 5. Turn your hand over, palm up, do the same exact thing. Depending on how big your hands are, how much overlap are in your strokes, you're going to get around 3 to 4, maybe 5 hand placements from wrist to elbow. It's okay if you overlap some, as long as you're letting everything fully bounce back to where it should be. You should not do one long sustained stroke. It's just not as effective. After you've completed the 5 repetitions on both sides of the forearm, we're going to do the hand. I would recommend resting your hand on a table or on your knee. Use a stationary stretch over the top of the hand, or directionally stretch over the length of the hand from fingertips up. Individual situations are going to make certain things feel better or worse. This is why it's important to discuss it with ideally a lymphedema therapist if you're working with somebody that is familiar with manual lymph drainage, so you can work on the specifics of your individual situation. Another thing that gives people trouble a lot of times is swelling in the joints in between the fingers. One thing you can do to kind of get down in the valleys is lay your fingers on top and in between the knuckles of that hand. Stretch along in those valleys, putting a little bit of pressure and stretch. With individual finger swelling, one thing you can do is sort of a reverse milking, where you start at the joint nearest the hand, stretching the skin as you work your way to the tip and then back in toward the hand. So you can see I'm going to use just 2 fingers. And ideally use all of your fingers sort of around the finger that you're working on so that you can stretch all the surface area of the skin. You can repeat that with every finger. Do about 4 to 5 repetitions of each finger. This takes time, so prepare when you start doing this. After you do your fingers, we're going to come back to the hand. We're going to do the same thing again. The stationary circle on the top of the hand, roughly 10 times, more if you can, and massaging in between the valleys of the knuckle. Do this on repeat till you get your desired number of repetitions. We're going to then work in reverse order up the arm, what we did on the way down. Start palm up, stretching of the hand, the forearm. There's 2, 3, there's 4, last one, 5 is complete. Rotate palm down, wrist to elbow. There's 1 time. 2. Back to wrist. 3. 4. And 5. I'm going to go back to the elbow crease for stationary circle. 2, 3, 4, 5, 6, 7, 8, 9, 10. Inner arm from elbow to armpit. 1, 2, 3, 4, 5. Come back to the outside of the arm, elbow. 1, 2, 3, 4, 5. After you've done the outside and the inside of the arm, we're going to come back to the armpit. We're going to do our last 10 stationary circles here and at the neck. So we're going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then back to the neck, above the collarbone. Find the bone, find the depression above that. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that's a complete sequence of manual lymphatic drainage for the upper extremity. You can then mirror this on the other side if the other arm is affected, or both at the same time. You'll have to stagger them, of course. But that's it for the manual lymph drainage today. Check out our other content for more helpful information, and we'll see you next time. Thank you.